Hey future nurses, let's talk about meningitis. Now, this topic has been seen repeatedly by nursing students who took their NCLEX recently, so pay attention, okay? And as always, I have NCLEX review on meningitis on my YouTube channel at Scrub and Spoon. Go review it, okay? And don't forget to check out my website for Master Method Study Guide. All right, now let's go right into it. Meningitis is the inflammation of the meninges, right? And what is meninges? These are protective membranes that covers the brain and the spinal cord. Now let's break it further. Let's break it down. The pathophysiology of meningitis. This is when infectious agent or organism such as bacteria, virus, now enters into the bloodstream or enters through direct injury, travels to the central nervous system and the meninges and invades it, okay? And that is when inflammation happens in the meninges, right? This can also lead to increased intracranial pressure and you will see neuro symptoms, okay? Now, let's go to the risk factors for meningitis. Number one is living condition. If you are living in crowded space, right, there is higher spread of meningitis in crowded environments such as college dorms, military barracks, shelters, prisons, and many other crowded environments. Another risk factor is weakened immune system. Patients that are immunocompromised or patients with immunosuppression are at greatest risk of getting meningitis. Patients with HIV or AIDS, patients on chemo that have cancer and they're on chemotherapy, they are immunocompromised, so they are at higher risk of getting meningitis. Another one is neurosurgery or invasive procedure. This can be a risk factor for bacteria to get into the meninges, okay? And that will lead to meningitis, right? Lack of vaccination, skipping or missing your HIV vaccines can put you at risk of meningitis, okay? Also, if you miss your meningococcal vaccine, you may be at risk. And lastly, if you miss your pneumococcal vaccine, you may be at risk of getting meningitis. Also, recent or nearby infection can cause meningitis. If you have air infection or sinus infection, the bacteria or the virus can travel to the meninges and invade it. Okay, now let's move to signs and symptoms of meningitis. You can see fever, severe headache, nausea and vomiting, nuchal rigidity, which is stiff neck. This is hallmark for meningitis. Photophobia, that is sensitivity to light. Altered neural status such as confusion. Patients may also exhibit positive Brzezinski sign, I hope I said that right, and Kenning sign. So how Brzezinski sign is tested is the patient is lying flat and the nurse tries to flex the neck of the patient. Now, when the nurse tries to flex the neck, involuntarily the patient flexes the hip and the knee. That is a positive Brzezinski sign. And now for the Kenning sign, the patient is also lying flat and the hip is flexed at 90 degrees. And when the nurse tries to straighten the knee, the patient will cry in pain. And that is positive Kenning sign, okay? You may also see tachycardia and seizure, okay? Now, if the meningitis is in infants, you may not see the classic stiff neck because it is hard to determine because it's infants, right? But you may see bulging fontanelle in infants, high-pitched cry, poor feeding and irritability in infants, like signs and symptoms of meningitis in infants, okay? Now, let's talk about the diagnostic test for meningitis. That is how meningitis is diagnosed. Cerebrospinal fluid, the CSF, is obtained through lumbar puncture to analyze the CSF, okay? So this will help to determine if it's viral meningitis or if it's bacterial meningitis, and the outcome will determine the treatment. Number two, blood culture can be done to see if there is bacteria in the bloodstream because this will cause infection or even sepsis, okay? It is also done to identify the exact type of bacteria, and that will help to determine which antibiotics will work best for the bacteria, okay? Now, for the CSF that is obtained through lumbar puncture, right? If the CSF, they're gonna analyze it. If the CSF is cloudy, and the glucose content in the CSF is decreased, that is low. Also, if the protein content in the CSF is increased, if the white blood cell in the CSF is also increased. And lastly, if there's a positive gram stain, then that will be determined to be bacterial meningitis. So if you see all of this in the CSF, this will indicate or suggest bacterial meningitis. Now, if it's viral meningitis, the CSF will be clear. You see the difference? The glucose level in the CSF will be normal. There may be slight increase in protein and white blood cell, and there will be negative gram stain. So these findings will suggest viral meningitis. Okay, now let's talk about treatments of meningitis. If it is viral meningitis, they do not really require treatments. Viral meningitis usually resolve spontaneously or goes by itself. But if it's bacterial meningitis, this is life-threatening. Now, antibiotic will be given if it's bacterial meningitis, okay? And that is after the blood culture has been done. Also, corticosteroid can be given to reduce inflammation. You know, meningitis is inflammation of the meninges, okay? And corticosteroids such as dexamethasone, okay? Also, antipyretics can be given for fever. Analgesic or pain control medication can be given for pain because they will be in pain, especially with the stiff neck, okay? If seizure is a concern, then anticonvulsants will be made available or given if necessary. So seizure precautions is needed in meningitis. Now let's talk about prevention of meningitis. Now for infants, HIV vaccines are important. They help to protect the infant from meningitis, okay? Also in infants and in elderly, make sure they take their pneumococcal vaccine because this is a type of bacteria that causes meningitis. So if they take the vaccine, they are protected against meningitis, okay? Also for teenage kids, before going to school, remember I told you one of the risk factors for meningitis is crowded environment, crowded space. So before going to college, before going to the school dorm, to the college dorm, they should take their meningitis A and B vaccines, okay? And also the meningococcal vaccine for the adolescents and college students. That's about the prevention. Finally, let's move to nursing care for meningitis. First off, there will be implementation of droplet precaution for suspected bacterial meningitis, okay? And the patient will also be getting antibiotics. So for the first 24 hours, there will be droplet precaution while the patient is on antibiotic therapy. Also remember, I talked about seizure. Seizure precaution should also be put in place, like padding the bed rails if necessary. Okay, available anticonvulsants if it's needed, necessary, okay? Also ensure as the nurse to provide quiet environment with dim light. Remember I told you one of the signs and symptoms in meningitis is photosensitivity, is photophobia, which means sensitivity to light. So ensure there's a quiet environment to reduce stimulation, okay? And also dim light, so as not to trigger photophobia. Also, to reduce or minimize patients' increased intracranial pressure, ensure the head of the bed is set at 30 degrees. Also, ensure to keep the patient's head in the midline. Avoid suctioning, but if it is needed because of secretion, minimize suctioning. Make sure oxygen equipment is readily available should in case it's needed. And finally, monitor neurological status such as confusion, their alertness, the level of consciousness, okay? All right, guys, and that is about meningitis you need to know. Go ace your exam. Bye.